What causes anxiety from Jewish preconception screening results? Imagine waiting for news that could shape your future family in ways you never expected. That's what many people experience during Jewish preconception screening. This testing looks for carrier status of genetic conditions common in Jewish communities, especially among Ashkenazi Jews. These tests check if someone carries mutations in genes linked to diseases like Tay-Sachs, Canavan disease, or cystic fibrosis. If both partners are carriers for the same condition, there's a chance their child could inherit the disease. That possibility can cause a lot of worry and uncertainty. One reason for anxiety is the high frequency of certain genetic mutations in Jewish populations. For example, Tay-Sachs disease is more common among Ashkenazi Jews because of historical population factors. Knowing that many others in the community also carry these mutations can make the results feel very personal and stressful. People often think about what it means for their future children and worry about the health risks involved. Waiting for results can be another source of stress. The time between testing and getting the results can last from a few days to a few weeks. During this period, people often feel anxious, imagining all the possible outcomes. This is especially true if they are unsure about what the results might mean or how they will affect their plans for marriage or having children. Understanding the screening process and what it means to be a carrier can influence how anxious someone feels. Those who have good information and clear explanations tend to worry less. But if someone doesn't fully understand what being a carrier means or what their options are, they might feel confused or overwhelmed. This can make the waiting even more difficult. Social concerns also play a role. In some Jewish communities, especially more traditional or insular groups, there can be worries about stigma. Being labeled a carrier might affect marriage prospects or how others view you. This social pressure can add a layer of anxiety that's hard to ignore. Receiving a positive carrier result can trigger emotional reactions. Some people feel relief once they understand their options, but others might feel guilt, especially if they already have children affected by genetic conditions. The emotional impact varies depending on personal experiences and family history. The timing of screening matters too. Doing tests before marriage or during early adulthood can cause stress if someone isn't fully prepared to handle the results. Younger individuals might worry about how this information will influence their future plans or relationships. It's also important to recognize that the Jewish community's history of trauma, like the Holocaust, can influence how people respond to genetic risk information. Past experiences of suffering may heighten baseline stress levels, making the emotional response to screening results more intense. To help manage this anxiety, healthcare providers recommend thorough education about what carrier status means. Genetic counseling is essential to explain results clearly and discuss reproductive options. Counseling can help people understand that being a carrier does not mean they are ill, but that they carry a gene that could affect their children if both parents are carriers. Timing the screening at a point when individuals feel ready and well-informed is also helpful. Addressing social concerns openly within communities can reduce stigma and support emotional well-being. Overall, understanding the genetic risks, having proper support, and knowing that many carriers live healthy lives can make the process less stressful and more empowering.